Hello everyone, my name is Kelly Randalls and welcome to today's video. I am a student here at Liberty University for their Masters of Social Work program. Today I was going to be talking with you all about a couple of topics. Those are mandated reporting, duty to report, duty to warn, duty to protect for two different instances, and some legal terms as well as laws and ethics. And then we will also be discussing general boundaries of confidentiality. So again, my name is Kelly Randalls, and once again, I'm a student at Liberty University for their Masters of Social Work program. My husband is active duty Army, so we are currently stationed at Fort Liberty, formerly known as Fort Bragg in North Carolina. We also share a 1-year-old daughter named Samantha. We're also from Georgia, so we love Georgia football, anything Georgia sports, just Georgia in general. It's got my heart. So I just wanted to introduce myself super quickly, and now I'm going to jump into these terms. So the term mandated reporting, that refers to any profession that works with children. So your child care providers, school teachers, anybody in the school system, doctors and nurses, as well as I've heard in some cases that people that work in the field of cosmetology also have the duty to mandate reporting as well. So this is whenever you notify the authorities of any case of suspected child abuse, but it's not just child abuse, it's also for elderly people, so people in the nursing home, and handicapped as well. So basically any person that is vulnerable, doesn't have a voice and advocate for themselves, that are being neglected and abused. So for instance, say you are a social worker and you are in with a client, and the client comes to you and tells you that, oh, my mom has been hitting me. You need to immediately report those claims, because if you do not, then there is the potential to face jail time and even fines as well. When a patient reveals thoughts of suicide or doing injury to themselves, and say they even go as far as having a plan to carry out these thoughts, and they come in for a regular doctor's appointment, and throughout the day they say that they are, not throughout the day, throughout the time of the appointment, they say that they are in fact having thoughts of suicide, and they're contemplating it, and they have an action plan ready to go, and they're ready to just, get it done and over with. The doctor has a duty to protective measures, such as recommend the patients for further care inpatiently and for hospitalizations. Similar to this is the duty to warn. This it's like a reverse almost. So when a professional needs to intervene with a client who has expressed that they have thoughts or they are wanting to harm or cause injury to another person, then they have the right to either almost two options. You can directly call that person and tell them what is going on, so that way they can protect themselves, but also I strongly advise that you also call the police and the authorities to intervene and safeguard that individual as well. So in the case of subpoenas, because that comes up, and sorry if I sound weird, and sorry, I'm looking at my notes, and that's why there was a little bit of a pause. I had to type all this out because I do have a stutter, so if you hear me kind of struggling to talk, it's my stutter and I'm trying to stop it. So in the case of mandated reporting, duty to protect, duty to warn, if it comes up that there needs to be a court case about this, and the court can then request a subpoena for the doctor, social workers to release the client's notes to testify in court. And basically, whenever that happens, the doctor is required to do so. Any extra applicable laws or ethic guidelines that are important to the privacy of clients' information are referred to as additional relevant laws or guidelines. In certain nations, they may stipulate the medical personnel, and they must get, especially in the U.S., get it in writing, the client's written agreement before sharing any of their information to a third party in general. The term general boundaries of confidentiality refers to the more moral and legal duties owed by certain professionals to maintain the privacy of a client. information while simultaneously making sure that any possible damage to them or to others is disclosed and addressed. So now I'll just go into a little bit more deeper explanation of these things, since I did just a little like overview and almost like a definition type. So it is the legal requirement of certain professions, such as physicians, nurses, social workers, childcare providers, and even school teachers and anybody that works in the school system, and even in some cases, your cosmetology workers, to report any suspected cases of negligence or abuse or to a child or to someone else who is otherwise incapable. So that could also include the handicapped and disabled, your elderly, and also the elderly that are also in a nursing home. Mandated reporting is the term that refers to this legal obligation. For instance, if a client tells a social worker that they are being abused by a parent or guardian, the social worker has the legal responsibility to report this to the appropriate authorities. This is because the client disclosed the abuse to the social worker. So I have a little bit of experience with this because I currently work at one of the child development centers on Fort Liberty. So yearly, we have to do mandated reporting training and also training on the signs and symptoms of child abuse as well. So that way we are up to date on knowing what to look for in case a child is being abused. So in the terms of how I go about it, since I work on a military base, is that I first call the military police or the MPs, and then I call the North Carolina Department of Services here in my city, and then I call the Military Family Advocacy Program, or FAP, and then I notify my director that I have called these people, and then I do a written report of that so that a way my steps and tracks are covered. So those are the ways in my current job field that I have to report. The term duty to protect refers to the responsibility that certain professionals such as doctors, nurses, and social workers have to take the appropriate action when a client expresses thoughts of suicide, harming themselves, or harming others. These professionals include doctors, nurses, and social workers. If a patient confides in a physician that they are having suicidal thoughts, the physician has the duty to take precaution to preserve the patient's well-being. This includes sending the patient, maybe doing referrals for them to do like a 24-hour emergency visit to a psychiatrist or therapist, but it can also, get them started immediately on medication as well. And the maximum would be to admit them into an inpatient psychiatric hospital. The concept of duty to warn is related to the concept of duty to protect, but instead of protecting the client, duty to warn is whenever a client expresses that they are wanting to harm or cause injury to another person. They are then legally required to protect that potential victim by calling the victim themselves and contacting the authorities. In this scenario, the social worker may choose to inform again the potential victim or the authorities, and then if a court asks for documents or notes, such as the doctor, nurse, or social worker, that the profession is required by law to provide the data or notes in question and must comply with the subpoena. For instance, if a doctor is given a subpoena to court to submit medical records or notes, the doctor is legally required to provide over the materials that the court has ordered. The phrase "any further applicable laws or standards" denotes any extra laws of ethical standards that pertain to the topic of maintaining the confidentiality of a client's information. For instance, in some countries, there may be laws or ethical standards that require healthcare professionals to obtain a client's written consent before disclosing any information to them to a third party. This is because disclosing information about a third party is considered to be a breach of patient confidentiality. The general terms of confidentiality refer to the legal and ethical obligations that certain professionals have to protect the confidentiality of a client's patient while also ensuring that any potential harm to themselves or others is reported and acted upon. These professionals are required to protect the confidentiality of a client's information while also ensuring that any potential harm is reported and acted. So again, I thank you so much for this little session that I had talking about the limits to confidentiality, duty to warn, duty to protect, and mandated reporting, as well as other laws that relate to this, and also subpoenas. I hope I was able to address, your concerns, and if you have any questions, please ask, and thank you so much for watching. I'll see you soon.